failure to ovulate is one more factor where a female fertility is really hindered. What is it?
Yes. So failure to ovulate, let me explain it in a very, very simple term. So basically क्या होता है कि, एक जो menstrual cycle होता है, we can divide it into two parts. The first phase is called the follicular phase, and the second half is known as luteal phase. So somewhere in the middle, around between 13th to 15th day of cycle, most of the girls, जिनका regular cycle है, they ovulate. They release an egg from the ovary. But sometimes what happens is there is, because of abnormal hormone surge, we can say, or the hormonal changes which should normally occur are not occurring. Or even if they are occurring, तो ovary के अंदर egg बढ़ना शुरू नहीं होता है, and sometimes बढ़ना शुरू भी होता है तो release नहीं होता है. They fail to, release the egg. This is very commonly seen in polycystic ovary cases.
I see.
So most of the times what happens is, I'm sure everybody has heard about polycystic because this is very, very common. So what happens in this polycystic ovarian cases is that they need some kind of medical help to, make their eggs grow and then release. Then कुछ और भी conditions होते हैं, जैसे endometriosis एक disease है, pelvic disease है, जिसमें it is a known fact that sometimes the girls will make egg but it will not get released because उसमें ovary कई बार आसपास के टिश्यू से stuck होती है, चिपका होता है. So egg को release करने के लिए जो contraction चाहिए वो नहीं हो पाता है time पे. So that is another disease. So polycystic ovarian cases, they are known to have, उनका हमारे पास जो presentation आता है डॉक्टर के पास, clinical presentation, they will always say, doctor, I have long cycles. Sometimes the girls who have very short cycle also, that is also a sign probably they are not ovulating, because ये जो दो phases होते हैं ना menstrual cycle के, वो indicate करते हैं अगर regular cycle आ रहा है तो most probably the girl is ovulating every month, that's why she is having a period on time.
Yeah.
So those girls who don't have normal regular menstrual cycle, they should consult their fertility physicians if they are not able to conceive, because probably they are not ovulating in their cycles.
So for them, charting their ovulation is going to be very difficult because of the irregular periods.
Yeah, so this is very good question actually, because what happens is how we tell girls to start their ovulation. There are kits available in market, and they can start testing them day 9 onwards, and they do it alternate day, and then once they start seeing 2 lines means their ovulation is about to happen and they should start trying. तो जब cycle इतना लंबा होता है 40 days 45 days, so वो day 9 probably is too early for them. It becomes very difficult for them to track their ovulation. So best is to get an ultrasound done, and then be in touch with your fertility doctor. They'll be best to advise you, because right now for this particular problem I can't give you a generalized answer, because every patient is different, right? Sometimes they are making egg but not releasing. Sometimes they are not making an egg only. So different patients need to be treated differently.
So in short, if there's any sign of fertility issue, get a professional help. Go to the doctor.
Always better.
Right. I have a last question for you, and this is on a more personal note. In your practice, years of practice, what is that one particular incident that has left a lasting impression on you and has changed your entire approach to healthcare?
Yeah, so see, one thing which I will say is, I have really seen, which I will say is evolvement, something positive sign is many girls who are approaching us for fertility preservation, which is a very, very good thing. Because this, this awareness, I will say, कि जो लड़कियों को ये awareness आ गई है, and one girl is spreading the word to other one. So this is something which I find is a very, very positive move. And I always stress on this, that there are again certain gynecological conditions. अगर हम सारे, the whole fraternity of gynecologists, if all of us work together and think alike, that there are some diseases which decline the egg reserve very fast. And these are the girls who should be stressed on to approach a fertility doctor and preserve her fertility. It will be bringing a huge change in the infertility trends, I should say. Because agar timely procedure kiya jaye, so then it is going to bring a huge change. And I'm happy to tell you that many girls per month are coming for fertility preservation, those who want to postpone their pregnancy for one reason or the other. Maybe, career only, or sometimes they're not ready to get married, so many things. But this awareness is definitely going to bring a change in the as far as fertility practices are concerned.
Yeah, I mean, the younger me wish I knew that you could freeze eggs, Very quickly, you mentioned that there are certain diseases which impact infertility. Could you care to mention what kind of diseases?
So, see, one is tuberculosis. That is the topmost on the list, right? So, pelvic tuberculosis incidence is quite high in India, and it is seen that sometimes it affects the ovaries. Okay, so most of the times it is confined to the fallopian tubes. So, tubes is the structure which helps carrying the egg to the uterus. But sometimes it affects ovaries also. So just whenever it is affecting ovaries, so what happens is egg producing capacity wo down chala jata hai. Egg banane ka capacity or क्षमता that goes down in those patients. Plus, there is a condition called endometriosis, which everybody should be aware of again. So endometriosis actually is a disease which eats up the ovaries literally. तो उसमें क्या होता है कि so when I say eats up, please don't get scared. Don't show me those kind of. So what I mean to say is again, this disease involves the ovaries and the reserve, the ovarian reserve. So when I use this word ovarian reserve, what I mean is egg producing potential, the quality and quantity. So it goes down much before time, right? So tuberculosis is one, then endometriosis is another one. Then third, which I will say, I have seen that girls, who are having autoimmune diseases. So I'm sure autoimmune diseases, you must be knowing, but let me tell you what autoimmune disease होता है जब हमारी बॉडी की इम्यूनिटी हमारे सेल्स के अगेंस्ट एक्ट करना शुरू करती है. That is autoimmune. So in girls who are suffering from autoimmune diseases like Hashimoto's, then rheumatoid. So there are few girls where this autoimmunity will be there against eggs, against the ovaries also. So it is seen again that their reserves, they go down, and they take more time to conceive, and they face problems in conceiving. And once they conceive, then their pregnancies are also turbulent. There are more chances of say rising blood pressure in pregnancy and so many other things, even preterm labor and all. तो जब ऑटो इम्यून डिजीजेस होता है तो कंसीव करना मुश्किल होता है, साथ साथ प्रेगनेंसी को कैरी करना, आउटकम्स वी शुड से are not that great as compared to absolutely healthy girls. So these are some conditions which affect ovaries. So then again, if we talk about uterus, tuberculosis, then endometritis, that is infection of uterus, all those things. Because endometritis से क्या होता है, uterus की दो walls आपस में चिपक जाती है. So that's called Asherman syndrome. So again, the space where pregnancy has to happen, because uterus is what? Uterus is the house of pregnancy. So this house of pregnancy is not good enough for lady to conceive. Similarly, there can be diseases which are affecting tubes. So again, any disease which is affecting ovaries, or any disease which is affecting the fallopian tubes or the uterus. All these, and fibroid, that's so common in our population. So again, fibroid is something which occupies quite a space in the uterus. So if it is coming inside the uterine cavity, it is again a cause of infertility sometimes. So फिर surgically treat करना पड़ता है अगर fibroid की वजह से infertility होती है. There is so much to discuss, isn't
Oh,
it?
yes. I wish we had like, the entire day. One more question. When we talk about fertility issues and women getting the brunt of stigma, I'm sure divorces happen because of infertility. Is there a provision by the Indian law which protects both the female or the male partner, whoever is going through the stigma, in case of divorce because of fertility issues?
So there are no strict laws, but then see what happens is this is quite common problem in our country, and even I have seen many couples approaching me and telling me, "Ma'am, if I don't conceive, then my husband is going to divorce me." Right? So
Yeah.
you work hard on those couples, try to make them conceive, but what law is doing for them? This is your question. So like if divorce is filed, then the court definitely, they will examine the case and look for any solid grounds are there or not. So it favors females to some extent, when it comes to divorces. But then there is no strict law that you cannot divorce a female if only on this ground. You understand? I mean, there is nothing like that. If there is an infertility issue, then that's not a solid ground or something. So no strict laws against it as such in our country.
Got it. Ma'am, in your clinic, do you use a sperm washing machine?
So, sperm washing machine, it's the standard, protocol which we follow. We have a centrifuge machine, and we do sperm washing by either swim up or double density, depending upon what kind of a semen sample it is, right? So, we are using this over years. So my embryologist, they handle the sperm samples and they do preparations for us. But yes, definitely for all IUI procedures, even IVF, ICSI, we need sperm washing. We are doing it.
Would you ever recommend a home insemination kit to your patients?
Sorry, home?
Home insemination kit. Would you recommend a home insemination kit?
So I am not aware what is home insemination kit exactly, because unprocessed sample, yes, they can. Unprocessed sample can be inseminated, but what is this home insemination kit? Is this the same, the unprocessed sample?
Yes, like a DIY thing.
Okay, so unprocessed sample, yes, because there are cases where males, they suffer from erection issues and all. They collect sample in the container and they can inseminate. So, but then what you exactly are talking about, home insemination kit, is it the same I'm talking? So yes, that is allowed. And let me tell you that during COVID time, quite a few patients, I advise that you inseminate in vagina, because they can do in vaginal insemination, isn't it? So they were inseminating in vagina, and quite a few patients they conceived also.
Okay. So that does work. Well,
Yeah.
I cannot thank you enough. This has been like 40, 50 solid minutes of learning and more learning. Thank you so much for giving us the time. This has been 40, 50 minutes of intensive learning. And I mean, there are many points tonight which you made, which we haven't heard before. And this is going to be such an impactful interview. And thank you, because despite your busy schedule, you agreed to take time out. We have had some wonderful doctors, both national and international, who have agreed to come here just for the sake of destigmatizing infertility. And it is to these warriors such as yourself that we owe everything. Thank you.
So thank you, Jemmy, for having me. I thoroughly enjoyed answering your questions. And this move which your company is making, making people aware through your these interview sessions from doctors, it's a great thing you guys are doing. Thank you once again for having me. It was a pleasure. Thank you.
Thank you, Dr. Sunita. We wish Subak Health Tech wishes you and Bloom IVF the very best in the future.
Thank you so much. Thank you, dear.
It was a pleasure.
Same here. Thank you.
Bye-bye.
Yeah, bye. Bye.